This is Open Mind Alexander Technique. I'm Jess. Today we're talking about forward head posture. What is it? Why it matters, why you hear about it, and why you might hear an Alexander Technique teacher call it by a different name or describe it in different ways. So, forward head posture effectively is this. That name, forward head posture, is what's used by the medical and physical therapy side of things. Now, again, to be super clear, Alexander Technique does have a lot of wonderful benefits in more physical type habit symptoms, but it's not because this is a medical treatment. Alexander Technique teachers don't treat or cure. We teach skills. And a lot of these skills can have beneficial impacts, but it's only because you're learning to stop doing something that you were doing that was actually unhelpful, that you might not have realized you were doing. Forward head posture is frequently one of those things, but I don't call it by that name. I describe it differently. So this goes back to the way that we talk about the head and the neck and what's head and what's neck. So I've made some previous videos on neck and head mechanics as well as how muscles work, and we talked a little bit about how you can't pull your forehead up because there's nothing there. So this movement comes from a pull in the back of the neck on the skull. Now, if we're looking at the relationship between the skull and the neck, what that creates is pulling the skull back and down in relation to the neck. That's how we talk about forward head posture as well. What actually bends and goes forward isn't the head, it's the neck. That's a bend in your neck. When you do that, if you didn't tilt your head backwards, you would end up looking at the floor and you would do this. That's the same movement in my neck. The difference is what I do with the skull. So what I've actually done there is I've taken my neck forward and rotated my head back. So in Alexandria language, this is actually head back and down because we're specifying what's head versus what's neck. Now, yes, we are aware that the head is physically moving forward in space. Sure, that's a thing. But the reason we get specific about how we talk about this and why I find this a more effective way to describe what's happening is it gives you a framework for what to do about it. What's really going on there is a bend in the spine. Remember that your spine goes up to your ears. So, a way to work with not bending in your spine is to think about where the spine actually goes. I'm allowing my back to go up to my ears. I'm allowing my spine to go up to my ears. And I don't just have a back surface to my spine. I also have a front surface to my spine. So let's look at it on Stan. So on Stan, he's got this back surface of his spine. And this is what you can feel. So when you touch your own back or someone else's back, you'll feel these little knobs on these processes that stick out. That's the furthest back part of your spine. You also have a front surface of your spine, and it's really deep in there. Your spine's pretty thick at the base and gets more narrow as it goes up. So where it goes up into your neck and attaches to your head, that goes through the middle of your throat and attaches right around just behind your jaw. The front surface of your spine is a way to think about allowing length. Some people might find it most helpful to think about allowing length. Some people might find it helpful to think of it in a different way. The instructions and cues that we use in Alexander Technique tend to be pretty individual for different people. At least that's how I teach it. I find that if I just try to say, here's the one tool I want everyone to use, this is the correct phrasing, I'm treating it more like a magic spell that's supposed to magically work for everyone, and that's just not how people work. There's more than one human, there's more than one way to think about how we move. So, for different people, I'm going to suggest different ways to work with this, and this is why working with a one-to-one Alexander Technique teacher is so important. The teacher is going to be able to look at how you're doing things and make suggestions for you based on what they see working for you. We're really highly trained in visual observation as well as using our hands to help guide where can you be instead. So some options for how to work with going forward at the neck and pulling the head back really comes from the neck. So you can think about asking your neck to lengthen. You can think about allowing space. You can think about allowing connection in your head and your neck. That one can be especially helpful for folks who are hypermobile. So if we think about the spine as a series of blocks on top of each other, if I take these blocks forward and bend that tower in a particular place the same way habitually for hours at a time, for decades, you're going to get some problems with that area. You're going to get pain. You might even get as far as physical damage from the repeated strain and pressure on the front side of those vertebra blocks. So thinking about connection can help to balance that. So you're thinking about connection on all sides of those bones. The reason you might not want to think about lengthening or up or apart or anything like that with folks who are hypermobile is it can feel disconnecting and it can actually cause a tightening response. So that's the opposite of helpful. So lots of different ways to think about this. What I would encourage you to try with yourself is going through this process of noticing what's happening, preventing what you don't want, and encouraging what you do want. When it comes to going forward at the neck, ask yourself, what are you doing with your neck? What resonates with you out of these couple different tools that I've offered, or can you think of your own? What is a helpful thought that helps you organize yourself? Those are what we call directions. Any direction that's helpful, great, use it. Where is your neck? And how can you help yourself stay stacked on your spine so that your bones are holding you up instead of making your muscles have to do it? See what happens.